Much, Kevin, and welcome, Judd. It's great to be with you. Although you're not really roughing it at the moment, I believe you're just surfing in California on a Californian beach this afternoon. Was that right?
That was right. So coming here feeling very chill.
Yeah, that's very good. Now, a lot of the people on the call today will know of your work, a lot about your work, but many won't as well. So, just a few words by way of introduction. Um, so, an American psychiatrist, neuroscientist, and author, director of research and innovation at Brown University's Mindfulness Center, and also associate professor in behavioral and social sciences in the Brown School of Public Health, and also Brown's Warren Alpert Medical School. Studied neural mechanisms of mindfulness using standard and real-time fMRI and translating that research into programs to treat addictions, which is a particular area of interest of yours. And also founded the Mind Sciences Inc., also known as Dr. Jud. And I think Kevin's going to post a few links as well, so people, if they want to read more about your work and so on, they can do that after the webinar today. So, and that has a particular focus on helping people with things like anxiety, overeating, behaviour change. So today we're going to be exploring the science and practice of how mindfulness, self-awareness, and better self-regulation can assist us in facilitating healthy behaviour change and going beyond anxieties and everyday addictions that are holding us back. This, if you got the secret to this, Judd, I'm sure a lot of us will be very happy to hear it. I wanted to call today's seminar Breaking Bad and then in brackets habits, but I thought, no, I better not play off that. But I'd love to find out a little bit more about your background and what really interested you, got you into this line of practice and research in the first place.
That's a great question. It started with me being pretty stressed out just before I started medical school. In fact, I had pretty severe anxiety and didn't even know it. It showed up as irritable bowel syndrome. I'll spare everybody the details of what that looks and feels like, but let's just say it's pretty unpleasant. And my body was telling me that I was really anxious and I needed to do something about it. And somehow this John Kabat-Zinn book lands in my lap this summer before I start medical school. And I started meditating my first day of medical school. And I found that as I went through my medical training and my graduate school training, that I was getting good education, but I was not really getting a very practical education about how my mind worked and how to work with my mind. And yet, as I deepened my own meditation practice and started learning Buddhist psychology, I was really stunned by the precision and the practical application of these practices. And so I shifted my whole career. I still remember taking a big leap because back then people were telling me I was going to kill my career by studying mindfulness. This is back in the early aughts. And I was very convicted to, studying something I was very passionate about and doing research on it, as compared to doing what, other people could do, other types of more mainstream research. So this actually influenced me becoming a psychiatrist. I didn't think I was going to be a psychiatrist, and when I went into my hospital rotations, and my patients were talking about craving and clinging, and saw this very clear connection between what I was learning from the Theravada Buddhist practices and what my patients were talking about, decided to clinically become a psychiatrist and then also retool to become a neuroscientist and a translational neuroscientist to see how I could help people who are really suffering with addiction. And that broadened to, other things that people might not consider addictions, like eating and anxiety, but that's where it all started. Yeah, my own suffering.
So it seems like you didn't quite kill your career. In fact, in many ways, it might have been the making of your career.
Mhm. Yeah, it was a big risk, and I'm very glad I took it.
Mm. It seems so important, excuse me, so important to follow our heart of what we're really passionate about, because a lot of people don't do that in their career, sort of follow what seems to be an expected path or whatever. But just, I mean, this is before we get into the real topic of today. What is it that following your real passion, your heart in a career, what does that do for you? How does that make your career unfold differently, etc.? Like, does it
Yeah.
like give you extra energy and focus on it? Does it kind of help you to, the ups and downs of a career that often knock us off path that to help to keep you on course and so on?
Thank you for asking that question. It's a really interesting one. There are two pieces here. One is that I wake up every morning feeling very fortunate to be able to do this work from a research standpoint because, 20 years before, there were very few people doing this work and the pathways weren't set up yet. I think John Kabat-Zinn, for example, and others really set up the conditions to be able to do this. And so I do wake up very energized because I'm just so blown away by again, the precision, the accuracy, the depth of the Buddhist psychology. And I feel like we're just scratching the surface from a Western standpoint in terms of studying it. So I wake up energized, but that's from a research standpoint. I also wake up extremely energized when my patients, who have been suffering for a long time, they click into some of these practices and sometimes relatively quickly, and I can see the transformation. It's really a privilege to be able to watch people, change these recalcitrant habits. So yeah, it's a real joy to be able to do this work. Real joy.
Yeah, I remember going through medical school myself, and you learn a little bit of the theory of psychology and a little bit of theory of psychiatry, but it really didn't have any kind of direct effect. And I kind of almost had a parallel curriculum in my mind of teaching myself what I now call mindfulness and so on, of just to get through medical school and little moments. I just wonder whether education can be and should be more experiential, and whether learning is the health student, a psychology student, medical student, anybody working in these kinds of fields, learning about themselves, underpinning their learning about how to be a good therapist one day.
I would guess that you and I are a little biased because we've had the experience. So I would say absolutely. This was probably the most important education that I didn't get in medical school. And I see hints of it. Maybe you see the same as well. I see hints of it when now they're starting to bring more compassion training into the curriculum, for example. But that feels like that's just scratching the surface. It's, we talk about empathy and being able to empathize with our patients and things like that. And I would even argue that if we can't, if we're taking our patients' suffering personally, we're actually going to be suffering by trying to empathize with them. And so having a first person experiential education will help us develop both distress tolerance, but also foster, I would say, that the compassion, awaken the compassion that we all have, which will prevent us from burning out. My lab's done some work on physician burnout, and with mindfulness, some very simple mindfulness trainings can be very helpful for helping people with resilience. So, I would argue that it's essential for helping, especially young people as they're starting their medical education, to develop this resilience and develop this distress tolerance that will help them throughout their careers. And boy, what's going to help you be a better doctor than to be there and deeply listen to a patient and not jump to conclusions? It helps with differential diagnoses. It helps with all sorts of things. So that's what I would say. I would say it's essential. I'm not, I think it's hard for medical institutions, at least in the US, they're pretty conservative. And so they don't change quickly. And I would say unless, the people at the top really have this direct experience, it's challenging to argue how important it is. I don't know what's your experience?
Well, I mean, I couldn't agree more. And that's, I mean, I found that when I was looking to do some work in medical education as a young doctor, thinking there were things that aren't taught that should be taught. And Monash seemed to me to be very fertile ground for innovation and so on. So we from 1992 have had mindfulness as core curriculum, and the way that we teach it is very experiential. So we don't talk just about the theory. It's like, how do you practice and apply this? And it's sort of grown over time. So the 6 week mindfulness program in first semester of first year for your own needs, and then to learn how it can be used in practice. But at the moment, the final year students are doing a 4 week experientially based mindfulness informed compassion course. So that's a part of their core curriculum before they finish their degrees. So yeah, I couldn't agree more. And the students get a lot out of that. And I think it's something that, you know, medical schools need to do more of, is experiential deep learning. Um, I wanted to, all the work you've been doing with addictions and behavior. Uh, First question I've got is, are we a more addictive society than ever before? I mean, it seems like, I mean, the standard things, drug and alcohol and so on, but it seems like there's so many more addictions these days. Is it a more addictive world these days in affluent societies? If so, why?
I would say our brains have not evolved that quickly. So if you look at it from the perspective of the human brain, that element has probably hasn't changed much. But I think what you're touching on is that the neuroscience and the psychology, the research has gotten really good at truly understanding all the little ways that we can become addicted. So, for example, we used to think of addictions generally as taking substances, right? And so it was only relatively recently that people even considered behavior as an addiction. So, for example, social media, even, eating, compulsive eating along the addiction spectrum. And so if you look at things like cocaine and heroin and things like that, these are natural substance, or some are natural, some are manufactured, but these are substances that are kind of refined. Take cocaine for example. The coca leaf is not necessarily addictive, but cocaine can be very addictive. And I think we see a parallel in modern day with all the different ways that people's attention can be garnered and really captured. And it's kind of like the more you can refine a substance to become more addictive, like food. Like there food is a lot of food like items are very addictive now because they're designed that way. Social media, I think, is the same. And so I would say in modern day, we see a lot more addictive like behavior because there are so many modalities out there that are put in front of us. Like social media wasn't a thing, 30 years ago. But it's not just that these ways of capturing your attention have been put forward, they've been refined with tremendous precision. And, platforms like Facebook could do studies on hundreds of thousands of people in an hour because they have that many users. And so there's this rapid iteration and the refining even more and more and more of experiences that then make these things addictive. So, humans haven't changed that much, but certainly our environment has been engineered much more for addiction.
It seems like, whether it's in advertising or, in social media, as you said, try to hone in, set the algorithms, keep people engaged, with food, that people have studied how to addict, how to get a person to keep doing whatever it is that they're doing. I mean, it sells a lot of product, I suppose. So it's
Yeah.
very difficult in a lot of ways for people not to be unconsciously. And is this an unconscious thing most of the time for most people, that getting drawn into these things?
That's what it seems to be, is that, most people don't know how their minds work. And so they just think, oh, this is life, when
Mm,
they find themselves scrolling on their phone for an hour, like, oh, this is just how it is. And
mm,
so I would say that is very much it can feel like semi-conscious or trance-like or even unconscious, where they wake up 10 minutes later or an hour later and look at the clock and wonder what happened.
mm. There's gone another decade of my life. What happened? I just missed it.
Yeah. Yeah.
Is the for all these different kinds of addictions, and they're very, I mean, substance is one thing, but to, social media and technology, to to eating, and do they all operate through the same sort of neural signatures? Is it really pretty much the same kind of neural pathways that are behind all of those different addictions?
It does seem that they have some common pathways. Yeah. So the mesolimbic dopamine system, people have probably heard about dopamine. So this pathway, which is described as a reward pathway, but it's really geared for learning. It's a learning pathway. We learn something and then we set it up as a habit. So everything from eating chocolate to using cocaine to getting a bunch of likes on Instagram seem to activate the same pathway. And then there are all other pathways related to the self, like these self-referential pathways that also, or circuits, I should say, or networks seem to also share some common neurophysiology. So there's at least one, if not several pathways that are pretty common, whether it's a chemical addiction or whether it's a behavioral addiction.
Does that suggest that across these different kinds of addictions that there are very similar kind of approaches that can be useful for multiple addictions? I mean, we'll come to talk in a lot more detail about mindfulness, for example, but are there very common sort of aspects of treatment that can help across totally different kinds of addictions?
I would say from a mechanistic standpoint, so let's take the medical things aside. So, for example, alcohol hits a certain receptor, this benzodiazepine receptor, and benzodiazepines hit that receptor as well. So, there are these physical elements of physiologic dependence. And let's just place that off to the side because those have some unique aspects. For example, that's going to be different than opioid, which is going to be different than cannabis, for example. But with those physiologic receptor differences aside, if we look at this mesolimbic dopamine system, that is something from a mechanistic standpoint that seems to have a common pathway. And I mention that from a psychological perspective because that suggests that there can be treatments that target that aspect that might be common regardless of the substance or behavior.
Yeah. Um, it we often talk about habits, and we think of habits as, oh, they're just things we do generally, and we don't think of them as being addictions. Are habits and addictions just different points on the same continuum, or are they quite different things? Habits don't, sort of trigger the same reward pathways or learning pathways, or are are they related?
They do seem to trigger the same pathways. I don't know how you learned the definitions of addiction in your training, but in my training, I remember a very simple definition that I still use of addiction, which is continued use despite adverse consequences. And so if we think of habits, most of the habits that we have are extremely helpful, right? So imagine having to relearn, wake up in the morning and you don't know how to walk, you don't know how to put on your clothes, you don't know how to cook, you don't know how to talk, right? So most of the things that we do habitually, right, where we don't have to relearn them, are extremely helpful. And so I think of it as a spectrum, right? So if we think to the far end of the spectrum, we can have a habit of something that we do automatically where we feel like we have no control. And when it gets to the continued use despite adverse consequences piece, that's where it falls into addiction territory. But it's generally the same pathway. It's just, what the outcomes are in terms of whether we categorize something as a habit or an addiction.
Can a pattern of thinking, the kind of narratives we have running in our minds, can that be an addiction as well? Because very often when people are learning mindfulness, they'll notice this pattern of thinking, this line of mental commentary really doesn't do me any good, but I do it anyway. I just kind of want to dive into it again. I'm practicing mindfulness. My mind just wants to go to it. Can that be addictive as well? Is that using the same pathways?
It does share some pathways, and I would say, and actually thinking about, yes, there's some good overlap in pathways there. And so it depends on where somebody draws the line about, continued use despite adverse consequences. So, for example, and I wrote in my first book, The Craving Mind, I wrote about narcissism, right? Which is pretty much someone basically being addicted to people telling them that they're great, for example. And we see examples of this in modern day. Well, there have probably been examples of this forever, you know. Uh, but there's some especially prominent ones these days, and we're seeing how that type of thing causes, continued use despite adverse consequences, not just for that person, but for others as well. And so I would say, if you take that simple definition of addiction, continued use despite adverse consequences, absolutely that could fit that definition. Now, people can split hairs over it, but I think there are pretty clear negative consequences that come from things like that type of thing. Let's take maybe a less controversial example, obsessive compulsive disorder, right? This is where somebody is literally stuck in this compulsive thinking pattern and these obsessions that lead to compulsive thinking and compulsive behavior. I see a huge amount of suffering with that in people with OCD. So those are just a couple of examples. One that I never learned in medical school that could be driven in the same way is worrying as a behavior.
Mm.
I don't know what your experience with that is with patients or even and with yourself, but worrying, and I have a lot of patients that describe that they're addicted to worrying,
Mm.
and that can be driven through the same process. And the process that we're talking about here is reinforcement learning. So both positive and negative reinforcement. In fact, back in the 1980s, a psychologist named Thomas Borkovic suggested that anxiety could be driven through worry as a behavior. And it was largely ignored because that's when Prozac came out and everybody thought, oh, anxiety solved. I wish
Not
that were
quite.
the case. Not the
Yeah,
case.
yeah. Well, it is. I can remember running a mindfulness course, and it was for people with anxiety. And one of the ladies, high performing, own business and so on, but constantly planning and preparing and going over things, and it made her tense. And there's so much on my plate, but I've got to because I've got so much on, and it was just I just encouraged her maybe just a little break from that, and when walking the dog in the morning, because just to be present with the walking and take in the sights and the sounds and so on. Anyway, she came back and she made a really good effort to walk mindfully, and had a different experience and didn't feel exhausted at the end of it, but actually felt invigorated and enlivened by the walk. But we sort of had a little curious inquiry into what she was calling planning and preparation. And it really came to light that this was just worry pretending to be useful. And it seems, and recognize it in oneself, but recognize it also in others as well, that it masquerades as something that's useful. So it keeps drawing the attention back because it's going to solve something rather than just create problems.
We are highlighting something that is very subtle and tricky, which is, our brains planning is extremely helpful.
Mm,
If I didn't plan my day to make sure I made it to this conversation on time, things wouldn't go so well. So
mm,
planning is helpful, but then, it's like we can plan something and then we check to make sure we haven't missed anything. But the time we're checking that the fourth or the 14th time, we're
mm,
falling into the territory of worry because we're not actually the planning's done. The
mm,
plan hasn't changed, but we're suddenly spending all this energy caught up in thinking about like what could go wrong. And
mm,
so I think, this can be where our minds are extremely subtly tricky because they're like, oh, this is important.
mm,
Worrying's actually helping me until it sounds like this is what you help this person do as well is to see, oh, or ask the question, is this actually helping me? And how does this compare to simply noticing this, maybe planning, checking that plan, and then checking to see when that has moved into worrying, and then learning to drop the worry so that we can be present with what is.
that's right. Well, because she noticed that when she was just really present and was planning and preparing, putting things in place, etc., she actually felt good, not anxious and productive, but it was
Yeah.
very focused. Whereas this was a kind of a quite a distraction. I want to just circle back for a moment to something you said before about narcissism. And I
Mhm.
remember seeing a study on university students that the more they engage with particularly visual forms of social media, the more narcissistic they became. And we know how much social media can be addictive. Australia's just recently implemented a law to, and it's not an easy one to implement, but to, ban kids under 16 from engaging with social media till there's a level of maturity and so on. Do you think that's a good idea? Because this is obviously operating on a different level, on a policy level, on a legal level,
Mhm.
which is different to the behavioral one-to-one sort of teaching of a therapist. Do you think that kind of thing's a useful thing to do? Would you have voted for it if you had a vote for or against it? Or
I would have voted for it. So I'm glad that Australia is kind of leading the world in this respect. I think they're the first country to do
mm,
this.
yeah.
And so from a policy level, there are all sorts of laws in place for dangerous things. In the United States, you can't drink until you're 21, in theory. You can't drive a car until you're a certain age. So uh, I think of social media as kind of like operating dangerous machinery. You
Mm,
know, it's not that we should ban cars, and it's not that we should ban social media per se, but like you're saying, it's helpful to put safeguards on things that can be dangerous, especially at certain ages. So
mm,
I think that's a really good start. I
mm,
also think that that's not going to go far enough. And this is where, in my opinion, let's train everybody to know how their minds work so that it's not that, so they can learn to have this thing that is very powerful and know how to use it wisely.
mm. Yes. Let's come to say mindfulness and how that helps. What sorts of things has the research shown that mindfulness has been useful for in terms of behavior change or addictions? And then we'll drill down into, well, how does it have benefits that it has?
Mhm. Well, where do I start?
Yeah.
I think over the last several decades, there's been a huge boon in research around, habits, addiction, behavior change, and related things. So I would put anxiety into that same category of habit. And, there's work from many groups across the world, dating back several decades, suggesting that mindfulness training can be good for anxiety. Just naming some of the work that my lab's done, we've done studies with smoking cessation, for example, and got 5 times the quit rates of cognitive behavioral therapy, basically, like that, which is gold standard in the United States. We've gotten a 40% reduction in craving related eating. And in a randomized controlled trial we did with people with generalized anxiety disorder, we got a 67% reduction in anxiety versus 14% in the usual care. So those are just looking at some of the specific habit pathways that we've looked at, and there are others as well. It suggests that we might be able to target these common pathways. I'm just talking about outcomes there. We and others have done some of the translational neuroscience work to show how that's actually unfolding in the brain as well.
Yeah. So what are some of the mechanisms whereby, I mean, because to somebody who's not particularly experienced with mindfulness, it just looks like sitting in a chair doing a whole lot of nothing, wasting a whole lot of time. It's like get off your backside and do something useful. But there's a lot going on, isn't there? Like internally, if you are sitting down and practicing it, there's actually. So what are the mechanisms? How does that practice translate into being able to make conscious and better decisions and not feel compelled to do things that aren't helpful and so on?
And we could spend several hours probably going over the multiple different ways that it's the mechanistic ways that it's been shown to be helpful. I'll just highlight a couple.
Mhm.
So, and again, mostly some of the work that my lab's done because I know it the most. There's some actual counterintuitive mechanisms that seem to be at play here. One is, and this goes back to the Buddhist psychology, back to if you look at the the Pali Canon, these suttas that were written, 500 years after the time of the Buddha, there are these descriptions of exploring gratification to its end. And that's kind of hard to understand sometimes. But what we've looked at is putting that in the framework of reinforcement learning. And it seems to line up pretty well that in the counterintuitive piece is that exploring gratification to its end suggests that if we pay attention to what the behavior is, we're going to be able to see much more clearly whether it's helpful or harmful, right? Whether it's and so that gets right at the mechanism of how habits form. So habits form through a simple, through positive and negative reinforcement, meaning if something's rewarding, we do something and it's rewarding, it feels good, we're going to do more of it. If we do something and we find that it's not rewarding, we're going to do less of it. So here's where the paradox comes in. I started this early on in my career. My patients would come in and try to quit smoking, and I would tell them, well, just go ahead and smoke. And they're like, well, this is the first time my doctor told me to smoke. But I would say, well,
Well, you
they were going to
started
smoke.
getting a lot more patients coming through. Yeah, this is the
They're
consequence.
like, hey, this guy is easy. He tells us to smoke. No, I would say pay attention as you smoke because I knew they were going to smoke anyway. They couldn't stop, which is why they were coming to see me. And they started to realize that cigarettes really didn't taste very good. They tasted like crap. And this gets right at the mechanism, whether you look at it from a Buddhist standpoint or you look at it from a modern psychological standpoint, they're getting what's called a negative prediction error. So they're predicting that cigarettes are going to taste and smoke, smell and feel, as the smoke goes down into the lungs like this, because they learned this habit generally when they were 12 or 13 years old. That's the average age of onset in the United States. And they were not paying attention. They'd check their phone, they'd do anything but pay attention to the cigarette because cigarettes taste like crap. So they start paying attention and they realize that cigarettes don't taste or smell very good. And they get this negative prediction error saying, this is not very rewarding. And that helps them become disenchanted with that behavior. So we saw this with smoking. We saw this with overeating, where it only took 5 to 15 times of somebody paying attention when they overate to realize that it really doesn't feel very good when you overeat. Your body's going to give you all the signals that you need to help become disenchanted with that. We saw the same thing with worrying. My patients come back when I give them this exercise and they're like, I don't get anything from worrying. And they're very confused because they think that it's like something that's going to help them live their lives. And they realize that it's making their lives really unpleasant. And so that's the primary mechanism that we see for habit, breaking bad, so to speak, that's at play. And it's beautiful because it lines up perfectly whether you look at it from a Buddhist psychological lens or you look at it from a modern neuroscience lens. So that's the psychological element. And I can also briefly talk about the neuroscience, what's going on in the brain, if helpful. But really, to me, from a pragmatic standpoint, that's gold because it means it's not about willpower, it's about awareness.
Mm.
We all have awareness.
Yeah, well, it it corresponds very closely with experience, not just personal experience, but experience of running mindfulness programs over many years is bringing that kind of non-judgmental curiosity to what's happening. A kind of just almost like an interested observer and bringing attention to the experience. And one of the things that seems to do, and I'd be interested in your comments on this, is it unhooks the attention from often the internal dialogue we've got running if we're trying to change a behavior. I'm terrible. I shouldn't be doing this, but I want to. Oh, I don't think I'm strong enough. Yeah, I've got to be strong. It's like there's all of this going on and full of judgments and criticisms of oneself, but the actual paying attention to the behavior unhooks from that and brings awareness to the actual experience. And often, as you've said, that kind of, what's so good about that? And, it's like, oh, I've never really noticed the cost that comes with it and so on. But that non-judging, that not criticizing ourselves and so on, seems to be very crucial in bringing awareness to the activity.
It does, and I think you described it beautifully. The story that we're telling that's on top of our experience, one, takes a huge amount of energy. but two, it actually distracts us from our direct experience. And so, for example, if we're trying to really see what we get from smoking or overeating or worrying or whatever, that narrative can get in the way, and it can be really hard to get the really good, clean data that are going to tell us exactly how rewarding that behavior is. And so, and in fact, these brain networks that seem to be pretty common with addictions, one of them is the default mode network, which is a self-referential network, which is involved in exactly what you're talking about. These stories that we're telling, whether we're regretting the past or worrying about the future. And we and others have shown pretty definitively that that network gets, well, I'll say we just finished a large study with people with a lot of anxiety, comparing them to people without anxiety, people and meditators. When we give a personalized worry scenario, their default mode network lights up like a Christmas tree, the people with high anxiety. It lights up less in people with low anxiety, which makes sense. And it's basically no more than baseline brain activity in experienced meditators. And in all three, in all three groups, when we give them a very simple mindfulness practice called noting practice, this is a Burmese practice, where we're just noting our whatever's happening in our sensory experience in the moment, all three groups deactivate their default mode network below baseline. And so with 15 minutes of training, somebody without any previous experience of mindfulness can go from overactivating this default mode network where they're caught up in the story to actually deactivating it.
Mm. Yeah. I think Kevin's going to jump on as well. Just,
Oh.
I mean, a little footnote, and then we'll take some questions because they're coming in. It happens sometimes with something like forgiveness.
Mhm.
Got some resentment or whatever, and and it's always found to be very helpful to sort of not criticize. Do I have to forgive or don't I? Or not to criticize that, but just to bring awareness to the effect of not forgiving or holding on to the resentment and
Mhm.
see whether it serves you well or not, because it's not somebody else you should forgive or shouldn't. It's just, but when people bring that again, that kind of non-judgmental awareness, it's like, gee, it costs me a lot,
Yeah,
costs a lot. And yeah, that's been transformative as well. You happy for to take some questions, Judd?
absolutely.
Fantastic. Kevin, looks like there's a few questions
Awesome.
coming in.
There's a lot of questions coming in. There's a lot of people online as well. There was 130 plus. So yeah, really, people are quite enthused about seeing you, Judd. So that's a great thing. And it was nice. There was just a question about the Burmese method of noting and how that relates to addiction from Iran. And so you just actually answered that, which was really cool. But there is a question from Sarah Strohmeyer. She's our question master. Every session she jumps on and asks lots of questions, which is great. And so she was wondering about how do we actually develop a habit around mindfulness? So how do we actually go about doing that? Are things like goals important in that? And also like how much, if you're wanting to develop a mindfulness habit, like how much should you be trying to do? So yeah.
Great question. So I would say goals, well, we can have a goal of developing a mindfulness practice, let's say, and that can certainly be helpful. It can kind of give us a signpost, but here I think it's helpful to see this as a journey as compared to a destination. And so I like to use phrasing such as aspiration or kind of we often hear setting an intention, right? But kind of having a direction in which we'd like to move. And to me, the simplest direction is away from suffering. You know, like that's a pretty straightforward call it aspiration or goal or whatever. And it's helpful to have that as a very simple one as our kind of our guide, shining or North Star. Like, oh yeah, away from suffering, because then we can start to see, oh, am I moving toward or away from suffering? That's a good thing. So here, and then it becomes very individual very quickly. So depending on all sorts of things, our genes, our environment, our conditioning, this can determine what what our practices are like. And so often it can be really tempting for us to say, give me a cookbook and a number of minutes and this and that. I'm not suggesting that Sarah's suggesting that, but I'm just highlighting that because a lot of people can get stuck in this like, oh, I need a mindfulness cookbook. That's not, unfortunately, not how our brains work. I think it's helpful here to really understand how our minds work, which will help us individualize the different practices that we bring forward. And to me, two of the key attitudinal qualities, and Craig touched on one of them already, both of them actually, are curiosity, right? So using curiosity as a superpower to help us bring awareness to our current moment experience, but also bring kindness in. So being kind to ourselves, bringing kindness into our interactions with others, we can just see how beneficial that is. And so here, if we can, if we want to set up a habit. So for example, we have a program called Going Beyond Anxiety. And the idea with that is to train people to understand how their mind works. We start with, understanding a basic habit loop, getting into this, asking questions like, what am I getting from this? Bringing awareness to the cause and effect relationship of their behavior. But importantly, the third step is seeing how powerful it is to replace the judgment and the striving, like, I need to stop this, with curiosity and kindness. And those become the lay down the path in which we can walk. And then, and always looking to see, to check, are we moving forward toward that goal? And then if we don't feel like we are, just using that as a way to check, to ask, okay, what's getting in the way? So there are many, we could probably speak an hour on this. So just trying to give some of the highlights there. And I don't know, Craig, if you want to add anything to that as well.
Just that I'm sure that the people on this webinar today would be very happy to go for an extra hour and hear more of what you've got to say, but we better move to another question, I think.
Nice. Yeah. No, and there's a really nice segue here from one of the first questions, and I might, because there's so many questions, I might combine a few if that's okay. There was a question from Joel about your thoughts about the relationship between like empathy and compassion and how you might use that in clinical practice, and we could probably expand that to how we might use something like that in mindfulness. And there was just a quick question that followed up from there. And thinking about the worrying side of things, you brought up that worrying can be an addiction, and that look, if I don't worry, I actually won't get things done. And this kind of seems like a bit of a paradox. So maybe if you could speak to, maybe how we think about, as you said, like kindness in changing our habits, compassion, like how might somebody go about doing that, and especially with something like worry.
Great. So boy, this is multifaceted, multi-layered. I so the empathy and compassion question is a really deep and critical one. And so here, I don't want to. So the one-liner is that with empathy, if we're putting ourselves in somebody's shoes and they're suffering, we're taking their suffering personally to be able to truly understand their experience. And the difference between empathy and compassion, I think of compassio, to suffer with, we're walking alongside. So I think of it as knowing that someone is suffering, right? We don't necessarily need to know every nuanced detail of what it's like to, if somebody broke their arm and they're in pain, that we have to break our arm to know exactly see that and feel that they're suffering. And that critical difference there is taking the suffering personally with empathy and not taking it personally. And that shifts the relationship from one that is about me, taking something, versus not about me. And the not about me specifically, it's described in Buddhist psychology as an immeasurable, because we do not get burnt out when we tap into compassion, when it's not about us and we can feel someone else's pain. There's a lot more to say about that, but I did a whole, it was part of our physician burnout course, or clinician burnout course, that anybody can take. It's on my podcast, that really goes in depth in the first and or second lesson in there. People can take a look at that. It's just the Dr. Jud podcast. And so for more, I would say take a look at that. We've also started publishing some of our research from the last couple of years on burnout. And we talk about that a little bit in those papers if folks want to look those up. Remind me of the question about worry. now? Because I think that's related, but a little bit different.
So you were saying that like worry can be a kind of addiction, but you also mentioned as well, it's like some people go, well, I need to worry to get things done, and so just maybe how do we tie kindness and compassion into overcoming something like worry?
Great question. So here, often, especially if we're very anxious and we worry a lot, and we get something done, there can be this correlation that we mistakenly think is causation, meaning, oh, I worried and I got something done. Therefore, when I worry, I get things done. That does not mean that we need to worry to get things done. And in fact, often we're wasting energy worrying, and we can get plenty of more things done when we're not worrying. So here, it's helpful to basically know these habit patterns of the mind, but also as you're highlighting, it's critical to bring compassion to ourselves. So if we're judging ourselves for, I have a lot of patients who feel like they're broken or there's something wrong with them because they can't stop worrying. If that can be a habit loop on top of the worrying habit loop that kind of keeps that flywheel going for both of them. And so here it can be critical to notice when we're judging ourselves, and notice what it feels like. Like, what do I get from judging myself versus what's it like when I give myself a break? This is where compassion can be critical. When we just feel into both of those, to our brain, it's a no-brainer. The compassionate stance, oh, this is hard, right? Even something as simple as that can help us kind of relax into the moment and maybe start to let go of that constant self-judgmental habit loop, which then helps us repurpose that energy to breaking all of these unhealthy habit loops.
Nice.
One last question, Kevin.
Go one last quick. Okay, so I usually am with a big one, I'm gonna do that to just to throw you a loop in the last minute.
Please.
Look, okay, so like aside from behaviors and addictions themselves, there's Jamie asked this by the way, and the associated habits of repeating behavior. Is there an addictive element actually to suffering itself? Can we be addicted to suffering?
Great question. Yes, I think so. And the short answer there, I know that we're short on time, is that there's a lot of research suggesting that we are creatures of habit. And so it might feel more comfortable when we are in the habit of suffering than stepping out of suffering. I've had a number of patients who've been anxious and worried all the time. And when they stop worrying, they start worrying that they're not worrying because it feels unfamiliar and they're in unfamiliar territory until they realize, oh, this is just different. It's not necessarily dangerous because our brains are going to say, hey, this is different. Maybe it's dangerous. So absolutely, we can be in the habit of suffering and be very comfortable there, even though ironically, that comfort is in discomfort, the discomfort of suffering.
Well done doing that in about a minute. So that really appreciative of you like having such a succinct answer. For everyone, I've put in many of Jud's links into the chat there. You can find much of his work there with his Substack and the podcast and his website, and also the links to his new books as well. So yeah, we would really like to thank you for coming along today, Judd, and I'll hand over to Craig as well to give the last word.
Yeah, thank you so much on behalf of everybody in this call today. It was fascinating, and I think we just hardly scratched the surface, and we'll, as ever, be following your work with a lot of interest.